And first of all, the first speaker is research assistant Eren Sözüer. Her topic is Beyond the Dichotomy, a balanced approach to protection of health and privacy during the pandemic. And floor is yours, Sözüer. You can start.
Thank you very much, Professor Kaya. Good afternoon to all esteemed colleagues and dear participants. It's a very great pleasure to be here. As you might recall from last Saturday, we spoke on the issue of privacy during the pandemic with Professor Hio, and I think he set a great theoretical background for the issues that I'm going to talk about today, and I will mostly focus on the technological responses and how they implicate our rights, especially the right to privacy. So let me just start with sharing my screen and my presentation. As you can see, my topic is on the balancing of privacy and also other rights with our right to health during the pandemic in the context of technological responses to the COVID-19 pandemic. Let me start just by talking a little bit about what were these responses and what were the tools that were used by governments to combat the pandemic. So as you can see from these images, governments resorted to a variety of tools. These range from, as you can see in the upper left corner, drones that sprayed disinfectant or enforced measures of social isolation and other measures. Cameras were widely used. They were very widespread, be it image cameras or thermal imaging. And most of the times, facial recognition was embedded in these cameras. And now the technology is at a point where researchers are working on if faces can be recognized even with a mask on. So facial recognition and thermal imaging was one of the technologies that were mostly used in combating the pandemic. Of course, thermometers, in addition to thermal imaging, were very common, as you can see in these images, and they were used by the government as well as the private sector. Those from Turkey would be familiar with the use of thermometers by private security officers in Turkey. And in addition to such hardware, phone signals, location data, and mobile communication data was used. So in the upper middle, you can see the mobility data in Germany. This was also, this map was built by a group of researchers in Germany by using mobile phone data to see where people were moving and the density of these movements in each region. And in addition to communications data on the mobile phones, we saw that social media and as well as internet history was also monitored to correlate the activities and the search engine queries with infections. So this was mostly a predictive analysis as opposed to directly determining where people were or whether they were actually infected or not. Also, identity technologies were also resorted to. So these were mostly existent before the pandemic, of course. But as you can also see in this image, and you might also be familiar with your own use, QR codes embedded into identity technologies were very frequently resorted to as a way of determining who is infected or not, or whether they can enter a certain area or if they can use a certain service. And it's important to note that some of these technologies have been combined with each other. So we saw that thermal cameras were installed on drones. So these are not really different from each other, or they're not exclusive, but they're combined with each other. And of course, immunity certificates are technologies that even if are not that widespread at the moment, but we're discussing after we flatten the curve so that we can enable people to travel between countries in particular. And I would also like to note that artificial intelligence, AI-based technologies are embedded in many of these tools. So these are used in triage at hospitals. They're used to scan faces to check temperatures. They're the basis of facial recognition. And they also track the spread of the virus and so on. And many epidemiologists they insist on projecting the spread of the virus and that it is essential so that we can take steps to combat it before it has already spread. So we have to know who has the disease, we have to study the data to predict who is likely to get it, and then we have to use that data to plan and strategize accordingly. This brings us to a specific technology that I would like to speak about in my presentation, and that is contact tracing. So what is contact tracing? Contact tracing is actually not a new phenomenon. It has been used before in pandemics and endemics, but probably our generation had never heard of it until the COVID-19. So contact tracing is basically a method of, an essential method of controlling and tracking the spread of a virus. So it's one of the ways of doing that, and it involves notifying individuals when they have come into contact with others, so with others that may have been exposed to the virus, and it gives them appropriate advice, for example, to get tested or to self-isolate in order to minimize the further spread of the virus. And it's a way for public health officials to track the virus and to enable people to either quarantine, self-isolate, or get tested. And actually, widespread surveillance, I'm using surveillance in a general sense, but surveillance in the public health context, it's required to time the distancing measures and avoid overshooting of a critical care capacity, which we saw in the first months of the pandemic was very essential. And even if we apparently eliminate the virus, this surveillance has to continue at a certain rate, since a resurgence in the contagion could be possibly as late as 2024, according to research. So public health experts are advocating that nations adopt contact tracing, that is tracing all people who have recently come into contact with a person that have tested for, excuse me, that have tested positive for COVID-19, and then take steps to isolate those individuals. And it's not just a method of containing the virus per se, it's not just a public health measure, but it enables governments to strategize so that they don't have to shut down large parts of the economy or the country, but they could contain the virus if they track it in certain areas, and they could shut down those regions or certain aspects of the economy in that sense. And what is unique to the COVID-19 perhaps is the efforts to digitize contact tracing. So you might have heard or even used digital contact or proximity tracing app. What do these apps do for us? So basically, first of all, they provide information about the pandemic. Users can log on to these apps and learn more about the disease from trustworthy sources, which is something we observed that is very important given all the misinformation during the pandemic. So first of all, access to accurate information. And then we have symptom checking, which is very important. It's a tool for public health authorities to guide citizens on testing for COVID-19. So to provide information on self-isolation, how to avoid transmission to others, and when to seek healthcare, so that hospitals are not overcrowded and are not blocked. And it can actually also complement primary care surveillance and better inform what the transmission rates of COVID-19 are. So if you think of your jurisdiction, there could be a lot of misinformation or speculation about the true numbers of infections. So these apps can actually be used for good in that sense. And another significant functionality of these apps is contact tracing, of course, and warning functionality. So these are tools to identify the persons that have been in contact with a person infected and to inform them about appropriate next steps, about what they need to do. So it's useful for both individuals and authorities as well, and it can play an important role in managing containment measures during de-escalation scenarios, and it can be boosted by a strategy supporting wider testing of people. And both of these last mentioned functionalities may also be a relevant source of data for public health authorities so that they can facilitate the transmission of data to national authorities who would then understand transmission patterns, and then they can take precautions accordingly. And as you can see from this map, this is very recent from yesterday evening. It shows which countries have taken contact tracing measures. And this is not necessarily digital contact tracing, but any kind of contact tracing, be it in the traditional or in the digital sense. And you can see the vast majority of countries have taken such steps to a certain degree. So if we focus on digital contact tracing, so how does it work? There's an app for that, and in many countries there's more than one app. So there can be a variety of these apps regarding how they work in the technical sense, but this image that you see, it actually illustrates that. So when two people get in contact or get in the proximity of each other, and their phones, they exchange a key, so they kind of get to know one another. So when they become one of the phone owners becomes infected, he or she updates his status in the app. And depending on whether it's a centralized or decentralized system, the person who had come in contact or in proximity of that app gets a notification regarding this, and either is prompted to get tested or self-isolate depending on the policies. And as I said, there are a variety of these apps, and it depends on how they work. So they might be based on Bluetooth or GPS data. Bluetooth is considered more privacy friendly because GPS data, which is basically location data, can give much more information about the whereabouts of the user, as opposed to Bluetooth just enables to determine if phones have or people have come in close contact with each other. And it depends on whether the data is stored centrally or not. And this is very important in terms of data privacy and security measures. And very importantly, these apps could either be voluntary or mandatory. So some jurisdictions have made the use of these apps mandatory, such as China, but some governments have made it mandatory depending on the situation. As far as we know, in Turkey, people who have been tested positive for COVID-19, they're prompted to use these apps. In this part of my presentation, I also want to introduce some of the topics that I will be revisiting in my presentation is the role of technology companies, the role that they play in our lives and in the pandemic in particular. So early on in the pandemic, Apple and Google, because they're basically monopolized the smartphone industry, they announced that they were working together to introduce a protocol, an API that app developers could use to develop contact tracing apps. And you can see there's an image of how that would work. And they presented that as a more privacy-friendly measure. So it's important to know that as governments are taking steps, they're resorting to technological measures, the private sector, big technology companies in particular, are following them closely, and they're trying to offer their services and also shape their role, the role that they will play in this pandemic. So some governments have adopted the Apple-Google protocol. Some app developers have used this, but some governments, such as France, have been more skeptical. Just to look at some examples of contact tracing apps, the one in India, which is Arogya Setu, it means bridge to health in Sanskrit, is the most downloaded app. in the world, particularly because India has made it mandatory for employees for both the public and the private sector. And here you can see that people actually can be jailed or fined in certain regions of India for not using the app. So this, as of July 2020, has been downloaded over 127 million times. And it's the most used contact tracing app in the world. And actually in the Q&A section, I would like to hear more about from people outside Turkey of what their experiences have been in their own country with these apps. And just to briefly talk about the situation in Turkey, in early April, the presidency of Turkey, they announced that they had come up with an isolation tracking project, which includes, among other things, the development of an app. This app, which is actually translated by the government as "Life Fits into Home" or "Life Fits in the Home," is actually kind of the slogan for many of the measures taken in Turkey, but also name of the app. So it was actually developed very fastly early on in the pandemic, and it was available in the app stores of smartphones. And it's this abbreviation, as you see, the HES is also a code that people can obtain to travel, and now they can see with this app which zones are presumably risky. And now in the upcoming weeks, people will scan this code to enter restaurants and cafes and places like that, and they can see if it's a safe place or not. And if we take a look a little bit at numbers, the download numbers. So it's actually very hard to find accurate information or precise information regarding the app downloads, because the government in Turkey has not shared how many times or how many people at least use this app, because the download times may not be the number of the people that are actually using these apps. So according to Sensor Tower, in July, it was downloaded on more than 11 million phones. So it's quite a high number, actually. And as I mentioned, this app or the HES system is actually very important, because people who want to take trains or buses or planes or such transportation or enter such places have to have this code, be it obtained from the app or the e-government system in Turkey. So as you can see from the numbers, this project, the Pandemic Isolation Project and the Life Fits in Home project, they really play a crucial role in combating the pandemic in Turkey. So, of course, in addition to these examples, we know that these measures were stringently in many countries in Far East Asia, such as Korea, China, Taiwan. But I just wanted to give you some examples which were a little closer to home. So, have these efforts been successful? Well, we don't really know, actually, because there are conflicting reports about, or opinions at least, about whether these apps or technologies have actually helped curb the spread, if not even halt, of the virus. So because it's really a combination, a lot of efforts that make the that flatten the curve or have other benefits. So we can't really say that because of a certain technology or the technologies we were able to combat the virus or slow down its spread. So we cannot single out certain technology, and widespread testing and access to health is actually crucial. And so in the early days, in particular, Korea was very touted for its efforts in containing the virus, especially due to technological measures. And they did do that. But recently, there's been outbreaks in South Korea that actually show that it has not been contained. So I'm not saying this is to blame because the technologies were inadequate, just as I'm not saying that the technology was the sole factor that brought about success, but there are so many factors that go into in combating a pandemic. So we really have to be very about putting a lot of trust and hope in certain technologies and seeing them as the saviors from the pandemic. And actually, time will tell. A lot of things are very ambiguous at the moment. So after this overview, let's look at the implications and risks of these technologies, and in particular contact tracing apps. So as you might have observed, these responses are heavily based on the use of data. So collection of data, storage of data, and otherwise all using of all kinds of data, predictive analysis in particular. So yes, we could say that prima facie, they interfere with our right to privacy and data protection, but they also implicate many rights and freedoms. And as I just mentioned, for instance, the use of codes, they have implications on the freedom of movement, access to services. So yes, they implicate privacy, but let's not forget that rights are oftentimes interrelated and interdependent on each other, the enjoyment of rights. So they have, they implicate us on a range, on a spectrum. So if you look at the preliminary issues arising from these technologies, so we have to first of all ask ourselves, will the tools work? So one of the unfortunate outcomes of this situation, this emergency, is that we had to temporarily suspend many systems which have made it extremely difficult to determine whether technology or data systems they can actually solve an important problem before we deploy them. So because we feel that this is an emergency, we just think that we could take any measure maybe as long as it doesn't cause harm. Maybe that's our threshold, but we want to resort to as many measures as we can so that we can curb this virus. But many researchers actually express that the technologies used, such as the use of location data, facial recognition, predictive analyses, they might not really help contain COVID-19, and they can actually do more harm than good. So we have this first problem of, will the technology work? So we don't really know because they're all very new and they haven't really been tested. And another important thing is that for contact tracing apps, experts estimate that 80% of users in a country, they have to use the app. So for the app to really halt the spread the virus. So a lower percentage could still help slow it down. But if we really want it to be effective, we need a higher percentage. And as you might recall from the numbers, so Turkey has a million of about 80 million, and only, let's say, about 12 million people have downloaded the app, and we don't really know if they're using it actively or not. So it's probably not as effective as we want it to be. And trust is a very important issue. So in the recent years, citizens have become very skeptical of how government as well as big technologies use our data, especially after the Cambridge Analytica revelations after 3 years ago. So trust is an issue for many people. But if you might recall what Professor Hio in his presentation was talking about, these different aspects, approaches to privacy, this could actually depend on the society. So certain societies may be more skeptical of the technology, whereas in other countries, people may not be aware, or they might not be as sensitive to these issues. So maybe that might be the case in Turkey, because as far as I've seen, there was no survey was conducted prior to the rolling out of this app regarding whether people will or not use it. And from what we saw was that this app was the #1 most downloaded app in app stores. So there was a lot of appetite for this app. So it might not be an issue in each country. But what is an issue for all countries all over the world is the issue of access to technology as well as digital literacy. So we know that there is a digital divide. Not everyone has a smartphone, and not everyone has an internet connection. Some people share smartphones, and some people don't have access to even electricity. So how can we really look at these technologies as these contact tracing technologies as a solution when people don't have access to that technology, or they might not have the tools themselves to actually use and understand the technology so that it would be effective. So these are significant issues that we should ponder before rolling out these technologies. And also we have the obvious short-term issues regarding data protection and cybersecurity. You might have heard yourself from your own searches and research that these apps, because they work on a vast amounts of data and on the sharing of data, they're very prone to cybersecurity risks and also such as the data breaches or phishing attacks. So people might be fooled into thinking that they're using an app for contact tracing, but they're very vulnerable to other attacks, and data protection is a very significant issue. So health data is considered sensitive data, so it requires much more stringent protection as opposed to other kinds of data. So these need to be adhered to, and the risks are much higher given the sensitive nature of these data. And also accuracy is a problem with contact tracing apps, because we might have false positives and false negatives, meaning the report of someone being infected might be false, or not being infected might be false. And always we could have trolls, people kind of abusing the system, giving misinformation and other things. So it's really up to your imagination at this point to think about what could happen. And I just want to also introduce the AI aspect at this moment. So you might remember that one of our participants during Professor Hugh's presentation, she mentioned what happened in the UK in the college entry exams, which because of the use of the algorithms and the AI-based technology, many students were discriminated against. So although they were expected to get higher grades and get enrolled in the universities that they had received an offer from, they could not because of the use of algorithms, which actually exacerbated the existing inequalities in the education system, and they discriminated on the basis of where they live and their socioeconomic status, ethnicity, and so on. I'm not going to get into the details of this, and you might ask how this is related, but I think it's a very telling example of how algorithms in general and also AI-based technologies can have such profound impact. So they can determine which university we can go to, and we know that it's being used in the criminal justice system. And these systems are used in areas which have profound impacts on our lives, such as criminal justice and also access to healthcare. So it won't be long before the predictive analysis used for predicting the spread of the virus could be used in our access to healthcare, and they're already being used to determine who is or who might be infected. So these machine learning based technologies, they're playing a substantial role in the response to the COVID-19 pandemic. So experts are using them to study the virus, its potential treatments, diagnose individuals, analyze the public health impact, and it's particularly been used in apps that leverage audiovisual data, text analysis, chatbots, and sensors. So even if it's not just in the context of containing the virus, we know that because now that our lives are so much more online, we are much more exposed to these technologies. So if we think of the general sense, they will have much more impact on us. So maybe we can talk about more of this in the Q&A section, but let's not forget about the existing problems with these AI-based technologies, such as dirty data, fairness, disparate impact, and so on. So if we talk a little bit about the long-term implications, of course, all of these risks that we mentioned are very important, but I must say that I'm a little bit more worried about the long-term implications of these technological responses to COVID. So one of them, I think, is rather the normalization of surveillance. So although we name these technologies as facial recognition or thermal imaging, they are actually, I think it's beneficial to frame them as tools of surveillance. So be it face surveillance, biotechnical surveillance, which is very at the spotlight during the pandemic. They're measures of surveillance. So because we are living in an emergency, we feel that we might feel that we should protest less when we're being surveilled and we're surveilled in a very in a very private sense. So if someone were to measure your temperature before the pandemic, I guess no one would, people would be surprised and they would protest more because it's such related to your bodily integrity that you would protest it. But now it's become quite the norm, whether we're entering a grocery store or any other place, that someone just comes and measures our temperature. So what's been done with all these surveillance measures is that it's actually kind of analogized to the Patriot era of the United States, where they, after the September 11 attacks, they established really stringent surveillance measures under the Patriot Act, which then enabled, as you know, from the Snowden revelations, to spy on the whole world, basically. But it was legitimized at the time in the name of security and public order. So it's very important to be cognizant of this fact that although we might feel that these surveillance measures are necessary, they're also actually being normalized in our sense. So, and if we're giving up these rights regarding our privacy or other rights, they might be very hard to win back, because that has been the case all along history. And as you can see from the headline on the screen, it's also become an opportunity for leaders who are already more have autocratic tendencies. They're using this as an excuse, but this goes for all governments, actually. In addition to the normalization of surveillance in our perception, then we have this issue of the repurposing of technology. So I've used the term surveillance creep, which is actually derived from the term mission creep, which means that if we've established a technology for a certain purpose, it might be used outside that purpose or that function. So we might not see as the drones that are inspecting us to take social distancing measures or other measures as surveillance measures, but they can and will probably be used for that purpose in the long run. So repurposing of tools is a very significant implication of all these measures taken during the pandemic, and not just after the pandemic, but tools have already been repurposed during the pandemic. So the government of Israel, they used the surveillance tools that they had been previously using on Palestinians, on their citizens. So they have turned it on their citizens to monitor the spread of the virus. So another example could be from China, where the already pervasive apps such as Alipay and WeChat, they include health codes set by the Chinese government, and these health codes, health statuses are nationwide, and they're used to determine whether people are allowed to go certain places. So tools are already being repurposed, and they will be repurposed. So, and this is not always in a negative sense. So, for instance, the CDC, the Center of Disease Control of the United States, they've tapped on their nation's best flu forecasting labs to retool its prediction algorithms for the COVID-19 pandemic. So it really depends on how you use the technology. So, but let's not forget that it could always be repurposed, be for good or for other purposes. So another final point that I would like to make regarding these measures and their impacts is the already disparate impact that the pandemic has on society. So this is a very recent announcement by the UN chief, Antonio Guterres, that the pandemic has disproportionately affected marginal communities, especially the poor, migrants, people with disabilities, and other marginalized groups. And the thing with technology is that, and if you also think about the access to technology issue that I just mentioned, it usually exacerbates these existing inequalities within societies. So because they make them more known, it's much easier, even if there isn't an ulterior motive in doing this, to discriminate against people. And sometimes it just happens, it's by design. So let me just give you an example from Turkey. So those living in Istanbul might be familiar with this. So these are two districts, two regions in Istanbul, which neighbor each other. They're on the European side. But, and this is a screenshot of their COVID-19 infection density from the HES app that I just mentioned. As you can see, one region is red, meaning there are many affected people, as opposed to the other region where most of it is barely infected, and even in regions there aren't really clusters. So I guess it is not hard to guess which region is the poorer one, which is kind of has a lower socioeconomic status. So which would be the region on the right, Şirinevler. So let's not forget that vulnerable communities, they will always bear the brunt, and there's this disparate impact on different segments of society. And contact tracing applications, it's very easy for these apps to leave out individuals without access to technology, and they could split these communities into. So when access to so many things is determined by an app, those who are allowed, so one segment of the society would be those who are allowed to go about their normal lives, and those who are, then there's this segment that is confined to their homes for an indefinite period of time, be it because they don't have the app, they don't have access, or because they are living in a more disadvantaged neighborhood, and this is known to the public officials, they're left out. So, and in the near future, when we have immunity passports and so on, employers could make decisions about hiring and who come back to work based on immunity. Then this would actually have a disparate impact on employees who could also be considered as a more vulnerable group as opposed to employers. And also, let's not forget that these technologies are actually first used on more vulnerable groups. So some monitoring technologies used for COVID-19 were actually first tested on refugees who wish to seek asylum in Europe. So, and they were surveilled and monitored by these technologies, and now they're being repurposed for COVID-19 purposes. And finally, a very important implication of these technological responses is the consolidation of corporate power. So you might have realized that either explicitly or implicitly, I refer to the role that technology companies play. And these are actually just a number of technology companies, because they have monopolies over over the sector. So their power is actually consolidated. So these are two examples from the US, but we can find these examples in many countries. So one is the partnership with Clearview AI. And you might remember this a company from earlier this year, which was exposed by the media that they were developing a technology. They had developed a technology that makes matches faces to a database of 3 billion images that they had scraped from the internet to train their facial recognition technology. And Palantir, you might be familiar with them because they're a big data company basically, but they are active in many sectors, especially the criminal justice sector. So they have, for instance, predictive policing technology. So, and now they're helping the CDC to monitor the coronavirus. So what could go wrong, right? Just sum up and make an analysis in the legal sense from all these issues that we've talked about. So we talked about the possible benefits for our right to health and other rights by using these technologies. And then we have our other rights that, and also other interests that are implicated by these technologies. So these rights and obligations, they're in potential conflict with each other, and let's also not forget the obligations of the states and our social rights, which have come to the forefront with the pandemic. So I guess there is maybe a trade-off, or it's expressed that there is a trade-off, but maybe let's not look at this as a trade-off. So that's why I named my presentation Beyond the Dichotomy. So let's not think of this as privacy versus health, because we know that these technologies, they might not always further our right to health. And on the other hand, most of the time, more than our right to privacy is implicated. So what should we do? How should we look at this? So I propose that we take a balanced approach. So what does balance mean? So we're lawyers, let's look at the law and how the law can enable us to strike a balance between these proposedly conflicting rights and obligations. So first, let's take a step back and think about the existing legal structure, what we have. So we know that the International Covenant, the UN Covenant on Economic, Social, and Cultural Rights, it guarantees everyone the right to the highest attainable standard of physical and mental health. So this is quite a high standard. And also the Covenant on Civil and Political Rights and the European Convention on Human Rights, they don't enshrine the right to health, but the protection of public health is a ground that governments can rely on to interfere with the right to privacy, among other things. So yesterday with Judge Pinto de Albuquerque, we talked about the margin of appreciation. So the European Court of Human Rights hasn't up to now decided on measures taken during a pandemic, but we might assume that the court might afford a larger margin of appreciation to states. So, and then let's look at the law very generally, very briefly. So first we have human rights law, which is considered as universal, but many of the rights under human rights law are also enshrined in constitutions of states. So under human rights law, proportionality is key in all measures. So even if a state has opted to derogate, so as we talked about yesterday, many states have actually announced state of emergency to combat the pandemic. So they're derogating from rights, and privacy is a right that can be derogated from. But even if a state opts to do this, proportionality is a fundamental requirement in all measures of derogation. So for instance, let's think back to the India example where people could be jailed or punished for not downloading the app. So this would be a disproportionate measure for not having a phone or the app or leaving the house without a phone. Such measures would be disproportionate. Similarly, forcing individuals to install these apps or to share the status they have on these apps with other institutions or people, such as their employers, their school, these would be highly questionable in terms of proportionality. So in all of these measures, proportionality is a key rule and test that we have to consider. But in addition to the proportionality as a principle, even before that, strong legal basis is a must. So if we think of how the pandemic has been combated in Turkey in the legal sense, a lot of presidential decrees have been issued as circulars by particularly the Ministry of Interior, limiting the right to free movement, which actually has disparate impacts on people depending on their age and status. So it's really then questionable if it's not based on a law that has been that is a law in the sense that human rights law requires it to be a law. So we have this possible ultra virus. So the executive branch acting ultra virus, acting beyond their legal authority to combat the virus. So again, comes the issue of we may not really question it because we think it's necessary, but we have to always keep in mind that a strong legal basis is a must in all sense. So, and then we have, of course, specific sectoral laws like specialities that are applicable to this situation. So, so how does data protection law enable us to strike a balance? So there are many principles of data protection law that are applicable and should be applied in this context. And I won't go into the details, but proportionality is among them, but also data minimization. So data should be collected as minimally. So it shouldn't be collected more than it's necessary. And it should be also deleted or anonymized as soon as possible or immediately after this emergency is over. So some apps have not, and some practices have not guaranteed that this app will be deleted right after that. And also limits on data sharing between agencies is very significant. From what I see in Turkey, the tendency is to really have a cooperation in terms of data share between the ministries of Interior and Health. Yes, of course, this is not possible. This is not. This is possible. It's not categorically prohibited, but limits. There should be limits on how this is done, and this is where data protection law comes into play. And let's not forget about laws in infectious diseases. So the law in Turkey is actually quite old. So many lawyers have criticized this law for, I mean, not the law itself, but it's big because it's so old that it's really not helpful with the pandemic. And what I observed, for instance, when Professor Hugh was presenting on Korea, because Korea had a more recent experience with the MERS pandemic, they had updated their law after that. So jurisdictions should also be make use of these laws and update it to enable this balance as well as protection. So in considering all these laws, one institution is very important, and that is independent oversight. So independent oversight in the use of data, it's also been expressed by the European Court of Human Rights. When vast amounts of data is collected and otherwise processed, independent oversight is a must because it enables safeguards against abuse of this data. So you might think of the role of data protection authorities, which is very significant, but we could even envisage an independent body with a wider authority than just data protection, because this authority also has to have some kind of independence in assessing the cases. So this body would actually have to be effective in terms of safeguards against abuse. And this is also a link to an approach that we would need in combating a pandemic is the interdisciplinary approach. So if we want to amend our laws or update them to enable us to strike the balance that we talked about, or enable effective protection against the pandemic, we have to have an interdisciplinary approach in building, in making these laws, and as well as other tools, because although this is primarily a health crisis, it has impacts on all dimensions of our lives. So you can see just a summary of what I talked about. And just going back to the previous slide, I would also like to emphasize the significance of soft law documents, such as guiding principles issued by bodies of the UN, the Council of Europe, the European Union. So even if a country is not a member state of the Council of Europe or the European Union, but they could still make use of documents issued by, for instance, their data protection advisors or other experts. So it's basically about the expertise that they provide. So we can look at all these documents to strike this balance. So what I would conclude regarding the existing law is that I think the existing law does need some updating, but mostly it needs effective implementation. So, and we must not forget about the interdisciplinary approach that is necessary for this pandemic. But even if we were just to apply the existing law, it would be sufficient enough to strike the balance that that I just mentioned. So, but in addition to law, one thing that I would like to finally mention is policy making, because we see that although the law plays a foundational role, policy is just as important, because there are these gray zones where the law doesn't directly get into, although it lays the building bricks of that. So I just would like to enumerate a few principles that we should be mindful of when making the laws or even policies, so as to complement the law. So the first one is the first do no harm principle. So this could, you might be familiar with this principle from many areas in law and outside of law, but I specifically observed this in the humanitarian help sector. So what they focus on is that we should, because they're dealing with people who are very vulnerable, first what they need to do is that they shouldn't cause harm to these people. So if we adopt this principle to our technological measures, these measures, before we can discuss if they have benefits, they should not harm the people that their users. So this is kind of in contrast with let's think of, for instance, Facebook, a big technology companies, their motto, move fast and break things. So no, we don't want to break things, even if we would like to move fast. So we really shouldn't harm in the first place. And this is very related to the precautionary principle. You might be familiar with this in environmental law and policy. And Professor Hio, he also talked about this during his presentation. And I think it's very relevant in this sense because it relates to technology development. So if we combine the precautionary principle with impact assessment, so before really rolling out a technology because we think it's very urgent, let's take a moment to make sure that we're assessing the harms, we're being precautious about it, and then we can roll it. So in the end, it would be much easier to strike that balance between conflicting interests. So I don't really think that the precautionary principle and the proportionality principle are mutually exclusive. They actually, I think, complement each other, and they play complementary roles depending on the tool and measure being used. So I think we can make use of both of them. And another very significant policy is transparency, which is also actually a principle of data protection law. So just to give another example of Turkey, but this also goes for some other countries that have used technological measures. A lot of policy making and technology building has been very opaque to citizens. of course, we appreciate that authorities are taking swift measures to combat the virus and build the tools for that. And there doesn't necessarily have to be an ulterior motive, but if we don't have transparency, we can't really assess as the public, this is a necessity of democracy, if we really want these tools to be used. So there should be a degree of transparency, at least after the rolling out of these applications. So let's think of the case of the contact tracing app. We should know how this app works, how it collects data, what are the possible risks, and how it has been developed, and so on, even if it's just the download count. So there has to be transparency, because this is the prerequisite for us to even think about striking a balance. So we have to know this is necessary in tech and government policy in general. So, and we should also be wary of techno-solutionism in this sense. I talked about the consolidation of corporate power. Another side of it is the overly being overly optimistic of technology, and looking at technology as a savior. Up to now, we can deduct from the examples that technology by itself, it cannot save us. So we cannot look at the technology as our savior, and we really cannot code our way out of this pandemic, because it first exacerbates the existing issues in our social constructs. So we have to first look at them, and then maybe we can think of technology as as a facilitator in some aspects. So it should be complementary, but not our savior. And it actually follows from this approach that we should take companies' proposals with a grain of salt. So in some jurisdictions, people might be more skeptical of governments, and they might resort to companies more, but we should also be skeptical of companies as well. So, also in accordance with the balance that we're seeking, of course, we should still be mindful of the good that technology can do for us. So recently, the director of the World Health Organization, he compared the COVID-19 pandemic to the Spanish flu, and expressed that we actually have a better chance than combating this pandemic faster because of the technological advances we have. So in the past few months, many researchers have actually been proposing privacy-friendly measures that are less likely to infringe our rights and are less likely to do harm, such as the DPT-3 protocol, if you would like to look it up. So, excuse me. So we should not forget that technology could also be used for good if we have some certain principles in its design. And I would like to just conclude with my final remarks, which are basically summaries of what I just expressed. So what I would first like to say that we need to think beyond this dichotomy of health and privacy, because it's a false dichotomy. So health is not necessarily always at issue, and also there is most of the time more than privacy that is at issue here. So, and it's very important us to have a critical look at these tools that are being used, because even not in the first instance, they are potentially tools of surveillance and the datafication of our society, which we're headed at, which is the profiling of individuals and people being seen as the state as data, as made up of data, and then their access is determined accordingly. So the vast collection of data could really serve that during this pandemic, and this pandemic could actually be the accelerator of that. And these the following bullet points are just notes that I would again like to reiterate regarding striking a balance between these potentially conflicting rights and obligations. So that will be all from me, and thank you so much for listening, and I look forward to your contributions and questions. Thank you.